Dr. James Kamalafe, thank you so much. As usual, you always give us priceless tips on how to take care of our mental health. And in talking about health, today is World Health Day. We're celebrating the World Health Day is the 73rd, I think I'm right on that, 73rd birthday or anniversary. 75th, good. 75th anniversary of the World Health Day. 75 years later, what have they been able to achieve? And today we'll be exploring achieving health for all Nigerians. Our guest in the studio is a consultant, neurosurgeon, and health advocate, Dr. Douglas Okor. Many thanks for being with us.
Thank you, Ifunaya and Joy, for having me on ASO Radio and TV.
You have a broadcaster's voice, not a medical doctor's voice.
Yeah, I don't know about that.
So maybe we should co-opt you into becoming a broadcaster. Good. So talking about World Health Day, and of course looking at Nigeria's health, sector. There's no, well, we have our achievements, but you wouldn't really say overall we've been able to achieve some of the goals that are expected when we're looking at the World Health Organizations and then the health indexes of countries. And of course, comparing the kind of wealth that Nigeria has, the kind of population Nigeria has, you would expect us to be, top notch. But we're not seeing that. What we're seeing in the internet is more medical tourism in Nigeria. Why do you think that Nigerian health sector hasn't been able to be at par with even other African countries?
Simple answer, Ifunaya.
I don't like simple answers.
Simple answer. The government and the people of Nigeria for almost 45 years have not prioritized healthcare. Okay. That's what they call the Sustainable Development Goals. Okay, there are 17 of them. Guess where healthcare is when you start counting from number 1? It's number 3.
It should be number 1.
But that's how important it is.
So I'm saying that's how important it is.
Okay.
Out of 17 is number 3.
Okay.
So for a very long time, all of us, especially our governments at all levels, federal, state, local government, have not prioritized healthcare. They've not had a body language or a stand or a posturing of understanding what we call value for human life. Okay. And so that's why when you look at in terms of the indicators of how a healthcare system should be performing, that's why we always perform poorly. Whenever you look at any indicator, you look at any numbers or any ranking, okay, we are always low because we have not prioritized healthcare. You only invest your money, your resources, your energy into things you think are important, even as an individual. As an individual, as a group, as a community, as a state, as a country, you only invest your energies into what is important. Now, for a very long time, healthcare has not been a top priority. And so, if you've not invested in it, your outputs that you get are equivalent to your
inputs. Spend a lot of money in the healthcare sector.
Oh, no, you don't. Sorry, you don't.
Or not enough.
You don't at all. No,
I want to understand.
Across board, Joy, in terms of the amount you're spending, in terms of the implementation of even the small amounts you're spending and stuff like that, we are struggling across board. Okay, and I can show you figures. Okay, the UK, for the United Kingdom, for example, has a population of about 67 million people. Okay, if you look at their annual budgets, the annual budget for healthcare will be probably about 18% of their total budget, and you'll be seeing figures like 250 billion pounds. Convert that to naira for 67 million people.
Staggering, I can't.
Wow. So, but if you look at Nigeria, 215 million people. You start seeing things, by the time you're converting it to dollars, you maybe get like maybe $1 billion or less and stuff like that. So it's a big struggle. We have this what we call the Abuja Declaration of 2001, where all the African governments came together and they were like, hey, we need to start pushing for healthcare. We need to spend at least 15% of our budget for healthcare. Since 2001, how many years is that? Almost 22 years. Do you think we are anywhere near that? So a simple answer to your question, Ifunaya, we have not concentrated on healthcare. We have not prioritized it. We have not mainstreamed it. It's not been a significant socio-political issue in Nigeria.
Okay,
and so let's
move ahead of this.
I'm speechless because because he said it was a very straightforward answer, and that's the truth. So yes.
But let's move ahead and now talk solutions. If you have to suggest as to where to begin to get these solutions, because if you look at the challenges in the health sector, I'm not sure they're significant. I mean, every single facet or department in the health seem to need help. So if you want to see the change in that sector, where would you think the government should start?
Okay, so the government should start with its mindset, first of all. That is the first place.
The political will?
the political will. You must have a
posturing. What do you mean by a mindset?
Yes, so your body language, your posturing, everything you're doing as government should be showing them, hey, we understand that healthcare is important. It starts from there first. If you don't get that right, the rest is history. You're not going to achieve anything. So the posturing, first of all, governments at all levels, okay, they must be showing. I don't know how they must be showing. For example, I expect that when the next government comes in on the 29th of May 2023, immediately you're getting a Minister of Health. Immediately you're getting a State Minister of Health. All the governors are getting their commissioners of health. Straight up, okay? One of the things we want to do, we want to see a strategic, almost emergency meeting where they are making health an issue of national concern. Okay, and they are pulling all themselves together, sitting down, all the governors, the president himself, all the two ministers of health, and the commissioners, and they are actually plotting a strategy and way forward. And actually, that strategy must be in very simple language where all of us can connect to it, and we can actually say, okay, you guys want to do this, you want to do this, oh, we can follow it, follow you bumper to bumper. We can know that, okay, you want to do this, you want to do this, you want to do this. Now, another key thing is that we want to see governments doing is that we need to integrate our healthcare system. It is too fragmented. Okay.
What do you mean by that?
Fragmented means that, for example, the states are doing their own, the federal government is doing its own, primary healthcare, local governments are doing their own. So we want what we call healthcare under one umbrella.
Shouldn't that help it get accessibility to everybody?
No, I'm talking about the integration. Okay, I'm not saying, oh, let one person be doing everything. I'm saying different people are doing different things, but they are integrated, it's seamless. For example, if you're going to refer somebody from a primary healthcare center to a general hospital at secondary level, and for the tertiary level, it should be seamless. Okay, technology will really help.
But it's not.
Technology will really help. We need to really get technology on board to actually help with that. Really, really, really important. So the key thing is that, like I said, One Health, integrated healthcare system. Healthcare under one roof. Then the next thing that they have to start doing is we have to start making our institutions work. Our institutions, they are not fit for purpose. They have to start working. Okay, institutions across all the way from the Federal Ministry of Health to your regulatory agencies and stuff like that, they need to start working. Okay, the key thing is that healthcare is a system. Okay, it's not one simple thing, and it's a complex system.
It is.
And so governments at all levels need to do due diligence. Right. And actually, as a system, there are different components of healthcare, okay? And so you must target those components and start working on each of them. There are about 6 of them, okay? The first one is leadership and governance, okay? We must get leadership and governance right. I've talked about a little bit about that. For example, we need all these people coming together, planning strategy. Yes. We need integration. Okay, we need to make sure that our institutions, the different ministry departments and agencies that have to do with health, that they are working properly. That of course, we need to throw in technology as well. Okay, so that's from a governance and leadership point of view. Second thing is the issue of funding and financing. I talked about it earlier on. You only throw resources into things that you think are important. Okay, so if you have 17 sustainable development goals and healthcare is number 3, okay, please invest in it. Okay, we have 133 million multidimensionally poor people, very poor people, and these multi-dimensions are about access. Access to what? Simple things, though.
Good healthcare.
Healthcare, sanitation and hygiene.
Yes.
Basic healthcare. I'm not just even talk about the big one, just the basic healthcare, basic education, even primary school education. So these are the fundamental things that we need to be investing in. So funding and financing, of course, we have the newly revamped Nigerian Health Insurance Agency Act and stuff like that. When it comes to the issue of having legislations, white papers, policies and guidelines and stuff, good. But the political will to translate those things into action on the ground,
implementation,
and implement them to actually serve the people is a big problem, because we have lots of people within our governments that are playing to the gallery. And so, as a people, in terms of all key players, all the healthcare professional organizations, I always call the Nigerian Bar Association, because they will need healthcare at some point. Exactly. All the civil society organizations, they need to, all of them also need to now understand, like, oh, healthcare is also important. Healthcare is not an afterthought. Okay, for some reason, as a people, it's only the day we now have a signal healthcare problem. We now remember, that's true, healthcare. Oh, we forgot about it since. No, it's so important. When they are doing elections in the UK, for example, general elections, what do you think is one of the key things that's going to be on the mainstream agenda?
Healthcare. Yes, it's always healthcare.
Because
what
you understand
paying,
the key issue of a value for human life. Okay, so funding and financing. We have the national health thing, the social health insurance scheme. The states have their own as well. They are doing their own. You can see why I say you need integration, because there are duplication of functions. And My dear Infunaya, we are a low-income country. Sorry.
Yes, we are.
When you talk about per capita,
we had actually spoken about
when
it.
you talk about per capita, we are a low-income country, and so that means that you must, even when you're investing your money, you must invest your money wisely. The two key things that you must invest in when you have 133 million multidimensional people, two key things you can't run away from it: healthcare and education.
And education, yeah.
Okay. All your bridges, your things, they are good, but I'd rather you put more of this money in healthcare. Okay, at least one of these, the four key things we need to be investing in moving forward. I hope anybody in the government, people that are coming, that are listening. Four things: power,
which is
security,
electricity, yes,
health, and education.
And education.
All the rest is jara. All the flying, when you see governors, they come, oh, we made flyover and stuff like that. Go and look at the rural areas and see how poor the people are. But yeah, they are putting money into flyovers. As if that's the most important thing that we need now. Okay, so key thing, our health insurance schemes must work. We must make them work. And how do you make them work? Like I said, the political will. Number two, you need data. You need data. So the National Population Commission is going to be doing a census very soon, isn't it?
Next
month.
Can
we please do it properly? And can we please now synchronize and integrate all the national what they call identity management, right, all the BVN and stuff like that? Yeah, synchronize all of them. And let's know who, where, what, and where people are, so you can actually plan for education and for healthcare for the people. Okay. Also, I'm hoping that in a stepwise manner, okay, over the next 4 years of the new administration that will come in, that they can slowly and cumulatively increase whatever we have in terms of our budgets
for health
to 15%. Okay, initially you cannot actually throw 15% into healthcare. Exactly. There's security. We have security situation in problems, isn't it? There's power. Okay, so you can't. But cumulatively, I want to see them.
So for every year they should build.
Every year it's 2.5%. Roughly, it's usually about 5% of the budget now. So if you want to get to 2.5, 2.5,
so from 7.5, and then we'll get there.
Okay. Also, we need a little bit of innovation in terms of funding and finance. Okay. We need special taxes, tobacco.
But we already have all those taxes.
Okay, but
I think the government is even planning on increasing those taxes. A good amount of that should be going to healthcare. Okay.
Data, for example, data on phones, a little bit going to healthcare. We have what we call this basic healthcare provision fund, which is 1% of the consolidated revenue. Yeah. Can we please slowly push that to like 10%? And all that should actually go to primary healthcare. Okay. 13, I've still the number one and number two. 13 is about health service provision, the provision of the service itself. Exactly. One of the key things, I want us to be bottom heavy. Okay. One of the key things, remember I talked about this 133 million multidimensional poor people. Where do you think they are? They are more in our communities, in our rural areas. Okay. Yeah. So at least can we invest a lot of money and resources into primary health care? Okay, in 4 years, a serious government can make a primary health care.
But if you go to primary health care centers now, I will not even take Panadol from there.
Good. So
because it's an eyesore. Yes.
In 4 years.
And then after how many years?
A serious government. Yeah. A serious government can make it happen. Okay. Because remember, Joy, you said let's talk about solutions, isn't it?
Yes.
We know all the issues. So I'm saying a new government is coming in May 29. Everything I'm talking about strategies of how we can actually move forward. Exactly. Yes. So I am saying that in 4 years, a serious government that really that puts all its energies and says, hey, we must make sure we do something significant in healthcare and make us as Nigerians proud of our healthcare system. They can do it in 4 years. Oh, I'm telling you the truth. A serious government.
Once they have the political will to do that.
A serious government in 4 years can give you a primary healthcare system that if Unaya would like to actually go into. Yeah, I'm telling you, a serious government. Okay, yes. So in terms of service delivery, investing in we have roughly about 9,000 wards in the 774 local governments. Each one of those should have a primary healthcare center that is worth its salt. Okay. Now, fourth thing, very, very important, the healthcare workforce. Okay, and that brings me to something that different people have been sending me messages this morning and stuff like that. Yesterday, or in the last 24 hours or 48 hours, the National Assembly, the House of Reps.
But we actually, we said, let me say before you say it, we actually said, we read it in the newspaper this morning, and they said they're saying that medical doctors can't travel until after 5 years. And then the first thing we said is, thank God we're having a medical doctor, because I thought it was ludicrous. But I said, okay, thank God we're having a medical doctor come into the program, and then, so go ahead. You have the floor.
So, key thing, healthcare workforce planning, okay? I'll bring back that word again, serious government. Okay, see, when people are serious, either as individuals, communities, a government, you will know the way they act and the way they do things. Okay, What I expected them to do was, first of all, go and do an in-depth analysis of what the problem is.
The root problem.
The root cause analysis.
Yes.
Okay. Do an in-depth, do some mapping. Okay. Mapping. Okay. Where healthcare providers, how many do we have? What do we have? What are we going to do about it? Remember, I said healthcare is a system. I know the doctors seem to be the poster child for healthcare, but no, there are other healthcare professionals. Okay. Now, the key thing is this. Okay, when you look at every professional or every person who actually went to tertiary institution in Nigeria, especially public tertiary institution, people who come out as lawyers, accountants, who come out as nurses, come out as doctors, dentists, come out as pharmacists and stuff like that. In the public world, they were all subsidized, all of them. Even most of the people in the National Assembly, they were all subsidized. So to now look at all these people that were subsidized and now pick one of them and say, okay, oh, we'll pick you. Okay, so we are not going to do this to you. You're not going to be able to go, you're not going to have your fundamental freedoms to actually do what you want to do. It's just playing to the gallery and being almost silly.
Exactly.
Almost silly. Okay, it just tells you that we have people within our governments that are not doing due diligence to actually look at the problems and say, okay, and actually start having strategic solutions. Number two, I don't understand. So you've not heard of proper consultation. Who did you consult before you just came out and start blabbing and saying things that people don't actually understand? And look at even the figures. The gentleman well, I'm calling him gentleman, saying that that we have less than 10,000 doctors. Where did you get those figures from? So you just spew things out. You don't have proper data. You've not done your research properly, but you just feel you're using your emotions to do things, and you want to lead people and lead people to the right place. No, that's not the way to do it. So workforce planning. What do you need to do? Okay, do a root cause analysis. Do occupational mapping. Okay, right. How many doctors do we have? How many dentists do we have? How many nurses do we have? How many midwives do we have? How many radiographers, pharmacists, physiotherapists, and stuff like that? Remember, it's a system. It's not about one healthcare professional. Exactly. Okay, it's a system. Okay, and so you must be looking at ways of how you can actually build up the system. Granted, you might say, okay, oh yes, the country has subsidized the training for some people, but guess what I'm saying? It's everybody, anybody
that went to a public tertiary. Yes.
So before you even start saying, okay, maybe we're going to start having some special pacts where people sign this and stuff like that, do your homework. When it comes to creating an environment and in terms of conditions of service, equipment, paying people remuneration properly as well, do those things first before you jump and start going and putting things in first reading, second reading, talking about extra 5 years, they won't get their full license. So you mean someone's going to practice for 5 years without getting full license, and the rest of the world is going to be looking at you?
But you do understand that it's a dire problem when 77% of black doctors in the US, for instance, are Nigerians. Any government that, I don't want to use the word serious or unserious because you would lash on that.
Yes,
but any government that is concerned about its citizens will want to do something about it.
And I'm saying, Joy, that they should do something about it.
Yes,
they should do something about it.
What I'm saying is, a lot of people had several solutions to how we can curb the brain drain in that sector. What would be your solution to it?
Guess what, Joy? I'm talking about the solutions already.
Yes.
I am saying take healthcare head on as a system.
Before we get to all you have mentioned, they are very key, what you have mentioned. But at the moment, we are seeing a rapid exodus of our doctors. So what would you say that the government should do, our lawmakers should do for now?
Okay,
so the administration
so guess what? It will be very silly, and I use that word with all due respect. It will be very silly for you to just want, hey, let's get a quick solution and stuff like that. No, you will not succeed in doing that. Right. You must be focused. Okay, you must look at what are the low-hanging fruits. What are things that we can do that's strategic? How can we do things in such a way that we're looking at what are the fundamentals, what are the building blocks, what are the foundations that we can actually create and start building upon them. Look at America and UK. They didn't get to where they were overnight, isn't it? They did some fundamental jobs. Some people died. Okay, some people paid the price and stuff like that. Unfortunately, at this particular point in time, some people will have to be paying the price. Okay, people will have to suffer at this particular point in time. But you have to slowly, you understand, in a think tank way, people actually using their heads and their brains and consulting properly before they start making such decisions that are going to be affecting people. How can you actually trample on people's freedoms to actually move where they are? And I say this again, you want to keep people for 5 years without full registration. So would you like a doctor who's not fully registered for 5 years to come
I wouldn't even go there.
I wouldn't even go there.
But let's move away from this and then look at maternal and child care. That's another very important sector. And of course, when you're looking at the indices of that, we're also on the low on that. We still have high maternal, death rate and then infant death rate and things like that. Things that we feel in the 21st century we shouldn't even be dealing with as issues. Now, as what would be a proactive way of being able to tackle and reduce the mortality rate in those sectors?
Okay, again, funny enough, all the things I'm saying, I'm already giving you your answers already. Okay, but this is something really key.
Yes.
With some of the calculations that I've seen recently, about 150 women die every day.
I know, that's why I brought it up about the child maternal
every
rate.
day. 150 women, and that's
a lot.
Okay,
yes.
So again, going back, okay, service delivery. Okay, we need to truly invest in our primary healthcare space.
But shouldn't we also indict the doctors by saying that they have this lackadaisical attitude? And then let me explain further. Now, we know that Nigeria is a poor income country. We know that as a fact.
Yeah.
We know that it's not just affecting the doctors, because even when they say, okay, the only doctors are japaring, they are japaring because they have a better, it's greener pasture.
Sorry to cut it there, not only doctors are japaring. Anybody who can
Mostly,
japa, who has the opportunity is japaring.
That's why the legislature is getting involved, because they feel, okay, we're draining out our doctors. People, even mechanics.
You're draining out everybody, not just the doctors.
Even the mechanics are japaring everybody.
Exactly.
But you find that more people, because they pay them well, and then compared to what they pay them in Nigeria, so they're not. They
So
don't
anybody
want to
who goes
here.
out before
So
Nigeria
the question
is paid better than Nigeria.
Yes.
Not just doctors.
Yes.
Anybody.
Yes.
Anybody at all.
That's educated. But the question is this: is it that now the doctors themselves too have this lackadaisical attitude because they know they're not getting paid well, and which is why I love the word you kept emphasizing on, because I knew I was going to get it back into our conversation. Nobody's actually paid. I would have been paid better if I was in another outside the country as a broadcaster.
True,
so it's that everybody good. So everybody we know, but we also find this lackadaisical attitude of the doctors in those primary healthcare centers, in the general hospitals. I'm saying it with all due respect, and I'm grateful to God that I don't have to go to a general hospital because I can afford a private hospital, which is very expensive. But the average Nigerian has to deal with all those things. And then you find out that when you go to the general hospitals, the kind of care you get there, it's terrible. Primary health center, the same thing, talking about this maternal high death rate. But when you come to the private sector, you don't find those high mortality rates there. And you also find out that sometimes it's the same doctors that own hospitals, that work in the government hospitals, that own the private hospitals, and they provide better services because they're charging you more. Okay. So I don't see the balance.
Again, if we are back to what I said before, it's not a doctor bashing session. It's about looking at healthcare.
Of course, we're not bashing the doctors.
Yes. I need to explain this very well.
Please do.
If nobody takes anything away from this, can we please understand that we're looking at a healthcare system? The doctor is just one of all the healthcare professionals.
I agree.
You can see you use the last 1 minute or 2 minutes to talk about doctors. I'm saying doctors are just one.
Okay, the nurses, the anesthesians.
They're just one. Please, can we look at the healthcare system? Okay, and we're talking about the healthcare system in Nigeria. So my question will be this: when you go into a supermarket or you go into approach any service and stuff like in Nigeria, and you're actually interfacing and engaging with a Nigerian, what kind of service do you have? Do you get good service the way you get in UK or US, whatever?
No.
You don't. So why are you expecting the doctor, the nurse, the physiotherapist, the radiographer, who is a Nigerian, born in Nigeria, growing up in Nigeria, seeing all these happening, you're expecting them to be different from the average Nigerian?
Of course not. But let's go back to the health sector and talk about the possibility of...
No, but you haven't addressed the issue of the maternal rate. So how can we curb it? I know you have talked about all these laudable issues and everything.
The key thing is that
it's still a very high rate.
Whether it's maternal and child health, to the maternal death, the under 5 deaths, the new issue of non-communicable disease, that is springing on us in a really big way and stuff like that. I've talked about all the issues. Okay? Leadership and governance. Invest in your human capacity and human resource for health.
Exactly.
Fund healthcare properly. Make sure that your services work.
And all this will miraculously change everything.
Absolutely, Ifunaya. Absolutely. Again, Joy, I told you, you cannot do a wishy-washy. You are like, oh yeah, let's just do one quick thing and to fix this. No, you must go back to the basics. Go back to the fundamentals. Start from the issue of, hey, first of all, are we prioritizing healthcare? Are we mainstreaming healthcare as a social-political issue? In the last, during the last campaigns and stuff like that, did you hear more about healthcare that you should hear? Something that is the number 3 out of sustainable development goals.
That's where my question was going to. Because I wanted to ask, first of all, you mentioned the NBA. That's an organization that has structured themselves. And I saw them interrogate the presidential candidates, especially. I'm not sure if they trickle down to 28 governors, really. Did we have that intentional interrogation of those who would man the powers and determine these kind of policies you have mentioned? And then while at it, you have mentioned all the beautiful things that can happen, but without the universal health coverage that we've been talking about in Nigeria for several years, do you think Nigerians, those in the rural areas, those communities,
103 million multidimensional poor,
especially, would they still have access if there's no intention, especially latching on the universal health care coverage?
Okay, so I usually talk about key players in healthcare that must put pressure. Okay?
Did we see that pressure?
We saw better than before, but not enough.
Not enough.
We need more. Okay? We need more. As an individual, when I go to, I'm trained in the UK, I'm a brain surgeon, I'm trained in the UK. When I go to the UK, nobody told me, oh, 6'4", oh, fine boy, come and be a neurosurgeon. I was put under pressure. Okay? So any individual, group, organization, state, country, government will only do better when you actually put pressure on them. You must hold them to account. You must hold them to account. Yeah. Okay? You must hold them. That's part of what we are doing now. Okay? We are actually sort of setting an agenda for them and say, hey, governments, you must do this, you must do this, and then hold them to account. That's number one. Number two, you said, oh, did we do enough? We did it. Was it better than the past? Of course, definitely. Whether you like it or not, it was a little bit more issue-based, the campaign.
Of course,
okay? Did I hear enough about that particular thing, that system that is number 3 in the sustainable development of 17? Did I hear enough? Absolutely, I did not hear enough. Okay? And for my social media stuff, like, I was always asking this question, hey guys, all the key candidates, are you asking them what is the strategy for healthcare? Because I'm very passionate about the healthcare system in Nigeria. Okay? I was born and bred in Nigeria. I'm a British citizen. I'm trained in the UK, but I'm back in Nigeria. That shows the passion.
Yeah, but why are you back in Nigeria? It's a beautiful question.
I'm back in Nigeria.
Because most people are running away.
Yeah, so I'm back in Nigeria because I know that despite all the ills and difficulties and inefficiencies and problems we have in this system, that there is still hope. Okay, I know that when you have governments and people and all the key players that are serious and understand the importance of healthcare, I know that we can reverse this and actually make something that we can all be proud of. And I want to be part of that. Okay, in a place like UK, I'm one of the brain surgeons. In Nigeria, I'm the neurosurgeon. Okay, the teams that I lead, even in private and in the public space, we make magic happen even with limitations. Complex brain surgeries, okay, complex spinal surgeries, with patients actually doing well. Whenever I go home, I was trained in Sheffield. Whenever I go home to the UK and I spend time with my colleagues, they look at me like a god. They are so proud of me because when they even watch the kind of videos or the kind of things I do, okay, with
like, the limited that you have,
with the limited resources that you have. Again, going back to what the National Assembly is trying to do, and trying to hold people. I left Nigeria when I was pretty young. I just finished medical school and stuff like that. And you can see in terms of competence, knowledge, skill, okay, capacity, okay, I was able to build that because I went to the UK, and now I've come back. That's what they call brain regain. We always talk about brain gain, brain regain. Now, my presence in Nigeria, whether you like it or not, has raised the bar in terms of the quality and the safety of actually providing complex neurosurgical care for patients. And we want more of that across board. And I'm saying that governments at all levels, especially the federal government, legislation, the National Assembly, they should be thinking that way instead of this knee-jerk, there's a very shallow approach that they are doing. You can see this is something I'm really passionate about. Okay?
I can tell
for someone who actually trained in medical school in Nigeria, went to UK, trained in the top best place and stuff, and I've been back in Nigeria for 6 good years, I know the difference. Okay, so when I'm actually neck deep and I'm really stressed in this place, I'm trying to do all my best to actually provide proper care and stuff like that. When I talk like this, people are wondering, why is this guy talking like this? Please, I have the right. I have earned it. The right to actually talk like this because I left a place, okay, where they have all this, and I've come to a place where there are limitations, and I'm pushing my best with all the people that I work with and the teams to actually make magic happen. And touch wood, Joy and Ifunaya, we are making it happen. So that means that there is hope, there are possibilities. Yeah. And so when we now see things like what the House of Reps are trying to do and stuff like that, it makes us bleed. We need serious people who understand what the importance of what we're talking about here. Because, like I always say, We must do this and keep pushing because the Nigerian patients are worth it. That's one of the first things that hit me when I actually got to the UK. Okay? I looked at them and said, what do these guys? They don't have no, they just have governments and people that understand the value for human life, and they put their resources into things that they understand that can edify and actually improve the lives of Nigerians. And we want that in Nigeria, and we will make it happen because, like I said, Joy and Ifunanya, the Nigerian patients are worth it.
And that's the best way to end this segment of the Nigerian Patient Awarded. Dr. Douglas Okor, it has been the best interview this morning. I mean, the passion, the desire, the ideas, it's obvious that you know what you're talking about. And then I would like to say kudos to you. And then best wishes, because like you said, one for all is all for one when we have a very good health system. So thank you so much for being our guest on ASO Morning. We've been talking with Dr. Douglas Okor. He's a consultant, neurosurgeon, and of course I must add this, a very passionate health advocate on ASO Morning. We'll go now to join, we'll go over and then for investment plus, and then after that the next interview continues. Do stay with us, we'll be back shortly.